Good evening, everyone. I'm Greg Hodges. I have the great pleasure of serving as the president here at Patrick and Henry Community College. On behalf of the faculty, the staff, the administration, and the board of our community college, we want to say a huge congratulations to this cohort of RN graduates. Don't they look good sitting up here, folks? I don't need to tell them, and I don't need to tell you that nursing school is not easy, but they have arrived at this pivotal moment. Let me remind all of you, you've got one more test left. Tonight's not the end. You've got one more test left. You've got your state boards, and you've worked too hard not to pass it on your first attempt. So we want to send words of encouragement to them over the next several weeks as they get ready. And I want to say a huge thank you to all of you, moms, dads, friends, siblings, spouses, children, caregivers, for all of the support you have provided them, whether you've given them a meal, whether you've helped them study, whether you've helped them with children, whatever you may have done to help them get to this point, we are very grateful. The work that they do changes lives. The work of their program changes lives, but they could not do it without you. And then I also want to say a huge thank you to our staff, our faculty who work in our RN program. What a life-changing program they're engaged in, and we are very grateful. I don't need to tell any of you, it's been a difficult couple of years, but you've arrived to this pivotal point. One more time, let this class know how much you appreciate them. Your program says that they'll come next a welcome from our nursing director, Amy Webster. Unfortunately, Amy is out ill with the flu, as she said. I could share that with you, so we don't want her here tonight. So Dr. Colin Ferguson, who is the Dean of STEM Health and Allied Programs, is going to give you greetings as well.
Good evening. I'm Dr. Colin Ferguson, Dean of STEM Health and Applied Programs, and as you heard, unfortunately, Amy can't be with us tonight. Well, we are here to celebrate the accomplishments of the students on stage. To reach this point, they have worked, struggled, sacrificed, and achieved. They should be proud of their accomplishments, and we are proud of them. Their accomplishments, though, would not be possible without the efforts of other people involved. I'd like to recognize the faculty and staff, particularly the nursing faculty of Patrick and Community College. Could you please rise? These folks work incredibly hard to make this happen. Thank you very much. I'd also like to recognize our clinical partners that work with us to make sure that we have the clinical facilities to make this program happen. And as Dr. Hodges said, all of you here tonight, I know many of you probably feel like you've been in nursing school for the past 2 years, studying, cooking, listening to people's thoughts and feelings about the program. So give yourselves a round of applause. Thank you so much for everything you've done to make this happen. And students, celebrate your achievements tonight. You've worked hard. Enjoy the moment. Just keep in mind, as Dr. Hodges mentioned, NCLEX is out there. That's just the next step on the journey. Congratulations and job well done.
Good evening. I want to start out by saying thank you. Thank you to each and every one of you in the audience tonight. Our families, our friends, our instructors. We could not have made it this far without y'all's love, support, and the sacrifices that y'all made for us daily. So when we started out this program at the height of COVID, we started out as little tiny boxes on a computer screen. Most of us were using Zoom for the first time, and we had so many questions and didn't even know at the time if we would have clinical, much less stand up here today. We weren't allowed to meet in person until 2 months into our first semester. We were also nervous and felt almost lost at times. When we started lab, we were required to wear a mask, face shields, and stand at least 6 feet apart. I'm sure we can all agree, we thought that was never going to end. We finally got to class in person second semester, and of course 6 feet apart and in masks, but our relationships with each other continued to grow. Luckily, when we reached the third semester, masks were finally lifted. Thank God. We were able to see what each of us looked like for the first time, and if I say so myself, we're a bunch of good-looking women. Now here we are all together, sharing this achievement with our support system. Little did we know when we first started, we were going to build friendships that would last a lifetime. We have all been through so much together, inside and outside of nursing school. But these ladies have been the most supportive group of ladies I have ever met. And ladies, we did it. After months of tears, late nights, sacrifices, and test anxiety, we can finally say we have made it. Now it's time to buckle down, pass the NCLEX, and become the nurse that we've always dreamed of being. Nursing school has given me a lot of angina, as Miss Plaster says, but we say angina in layman's terms, which means chest pain. But let me tell you that it's truly been worth it. I had a preceptor in clinical, Brittany Arthur, tell me one time about how she had an instructor, Miss Debbie Shelton, describe nursing as a tree, and I thought it would be fitting tonight as I wrap things up. The core values such as love, compassion, teamwork, faith, family, and friends make up the roots of your tree. It is what keeps you anchored. The teachers, clinical instructors, and the nursing faculty are the trunk of the tree. They are the ones who provide us support and lift up the branches. We as students are branches. They instilled in us everything we are and everything we embody. As branches reach out, we grow. We take different paths into different fields of nursing. As we branch out, we touch the lives of those around us, our patients, the families of our patients, and everyone in reach. And from our branches, new branches will start to grow. We will start to become teachers and clinical instructors, and these new branches will become the future of nursing, just as we are now. The lives we have touched are like the leaves. Some leaves will fall and flow with the wind, and some will be taken to someplace new. From these branches, we can touch the lives of so many. From these branches, blossoms will grow, leaves will develop, and time will change many things. But one thing is certain, our branches will make a difference in the lives of others. After tonight, we will go our separate ways. We will go to different units, different hospitals, and different cities. But no matter where we go or what department we end up in, we will excel, thanks to you all. After tonight, this chapter ends, and a new chapter begins. Ladies, welcome to your new beginning. Thank you. I now would like to welcome to the stage Mr. Brad Shelton. Brad graduated from Patrick and Henry Community College in 2012. He is a registered nurse with his Bachelor's of Science in Nursing, and now the Director of Acute Care Services at SOVA in Martinsville. Please welcome to the stage Mr. Brad Shelton.
Good evening. As stated, my name is Brad, and I'm the Director of Acute Care Services at SOVA Health Martinsville. I consider it a great honor to be able to come out and speak at your pinning ceremony, and an honor to have worked with you throughout the past few years. Since April of this year, I've been on the acute care floor, and before that, I was in the emergency department. But that said, I've seen the talent and growth of each of you in various settings of nursing, and again consider it an honor to be able to celebrate you tonight. I love nursing, love Patrick and Henry, and have loved working with each of you throughout your clinical journey. This is such a memorable occasion. I could never forget the excitement, the feeling of accomplishment, and the relief, while also having fear of the unknown, anxiety for the next steps, and a small foresight of sadness knowing that my typical day was about to change, as well as the lack of seeing some people I had grown to love. Each of you may be in a different stage of your life, but for me it was also a time of independence. I knew that obtaining this degree would mean that I could finally be able to take care of myself. I would be able to live on my own, which I'm sure there are parents in the room that are sad when I say that, and some who are probably thrilled. It meant I would soon start a family. It meant a sense of purpose and fulfillment, knowing that I was going to make a difference in the community I live in. This current night is special to me considering the time. As a lot of people celebrate a 10-year anniversary for completing a degree, this is my 10-year anniversary. 10 years ago, I was sitting exactly where you are as a winter graduate and part of Miss Wallace's first class. So I'm here to celebrate you and hopefully give you a few words of encouragement. Before I do that, I want to thank you. Thank you for choosing nursing as your profession. This is such a vital role in healthcare with an extreme need. As a former president once said, America's nurses are the beating heart of our medical system. Thank you to Patrick and Henry for choosing to come to Martinsville for your clinical experiences, and thank you to the teachers and students for helping my team take care of patients within the community. No doubt you've touched many lives already, and I know it's just beginning. If not mistaken, I think the last patient you cared for on your last clinical day on 5 consisted of you recognizing a patient who was in respiratory distress. You all reacted, you caught a rapid response, which resulted in the patient going to CCU to get the treatment that was needed. That recognition alone saved someone's life. We are very thankful for you. And now for the celebration. A famous quote from C.S. Lewis goes like this: "Hardships often prepare people for an extraordinary destiny." No doubt there have been obstacles along your path. For those that don't know, you often get responses to homework and tests like, "That is correct, Brad. However, it's not the most correct, so you got it wrong." And who doesn't love a good multiple answer, multiple choice question? I hope you can feel my sarcasm. Additionally, I know this program has evolved over time, but 10 years ago, the curriculum consisted of HESI tests. You had to take an entrance HESI and a HESI after each semester. It didn't matter how well you did in the semester. If you failed the HESI after 3 attempts, you had to remediate. Prior to the program, school was always easy for me. I could memorize anything, but when it came to actually knowing it or remembering it, I struggled. Retaining it, not so much. For the first semester, I thought I had it in the bag. I did well, but then it came to the HESI, and I'll never forget failing. What? I failed. That was very new to me. In that moment, I couldn't rely on the things that I had memorized or halfway retained. I had to take concepts that I had learned and apply them. I utilized all 3 attempts to pass that test, and I'm still thankful that God allowed me to pass on my 3rd and final attempt. Although I almost had a nervous breakdown, I needed to experience the defeat. That failure made me realize that I was going to need to change my practice, apply myself if I were going to pass. For me, everything changed from that point. I said all that to say that this degree is hard to achieve, and you did it. What an amazing accomplishment for each of you. I hope you consider this to be one of your biggest accomplishments of your lifetime. You are a nurse. An extremely hard job, yes, but what other profession is more rewarding and opens more doors? There's so many things that you can do. From the bedside alone, you can work in a variety of settings like the ED. You can work in telemetry. I got you. CCU, physician practices, a variety of specialty areas. If that wasn't enough, you can do leadership, you can do education, informatics, and technology. The list goes on and on. No matter what you choose, I hope you chose nursing because you love people and you want to make a difference, because that's exactly what you're going to do. You have the opportunity and will impact so many lives throughout your career, and I will speak for everyone that's here tonight and say that we are honored to be a part of this process for you. What's the motto? Save 1 life, you are a hero. Save 100 lives, you are a nurse. Reflecting on my why I chose nursing, it was because I wanted to make an impact. Growing up with a mother who's a nurse, I would often see her being approached by what I thought were strangers in the community who would thank her for taking care of either them or their loved ones. While seeing the impact that she made, I knew that I wanted that for myself. And now each of you have the opportunity to make that same impact. No matter how hard the job, if you always put the patient at the center of your work, you will make that difference. Most of us know these words by Maya Angelou. As a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. We care, we serve, we save, we teach, we advocate, we nurse. So for your new journey, I want to encourage you to do a few things for me. I have 3. 1 is stay focused. This day is huge. A day I hope you all can celebrate with the people that you love. Not to be a bummer, but you have one more obstacle to overcome. I don't want to spend a lot of time talking about that, but truly do what your instructors have asked you to do. They know what they're talking about. We all know this isn't easy, so after we celebrate this day, let's stay focused and get this done as soon as possible. 2, love what you do. There's so much to learn and embrace as you start your career. Easier said than done, but don't let a certain person or environment overwhelm you. Although some may forget it, everyone has started where you are. I trust that God has placed you exactly where you're supposed to be. So be patient with yourself and try to love what you're doing and love the moment. As your entrance song goes, rise up, take the world to its feet, move mountains, bring it to its feet. Rise like the day, be unafraid in spite of the ache, and do it 1,000 times. 3, always be willing to learn. Even when you think you know something that someone's trying to tell you, just listen. Even though you know it, oftentimes there's still a nugget of information that will help you with your practice. I know I'm repeating myself, but again, we are impacting the lives of others. That is a big responsibility, and we should always be willing to refine our practice and sharpen our skills. One of the many things that COVID taught us is that we don't know it all. As healthcare professionals, we're constantly challenged with the need to adapt and grow, again, while keeping the patient at the center and reason for all the decisions we make. That's my 3. Again, I want to thank you for choosing me to speak at your pinning. I'm a praying man, so you can ensure that a prayer will be said for you for what lies ahead. I pray your nerves will stay calmed as you take your boards, again, hopefully as soon as possible. I pray you find peace with the decision of employment, and I pray you find fulfillment in this amazing profession. And if you need anything, you know where I am. Thank you.
Catherine Alderman. Allison Boaz. Kylie Campbell. Katie Cox. Emily Curtis. Anna Deal. Morgan Joyce. Jessica Pyron. Julie Riddle.
The Jessie Fry Rhodes Nursing Scholarship was established in 2011 with a generous donation from Robert and the late Nancy Hubble of Collinsville. One award is made to a graduating RN student to be used towards the cost of NCLEX testing. Criteria for the award is a 3.0 GPA or higher, demonstrated financial need, residency in the P&HCC service area, and submission of an essay detailing the applicant's desire to be a nurse and contributions they plan to make to the profession of nursing. The recipient of this year's Jessie Fry Rhodes Nursing Scholarship is Julie Riddle. The Nursing Student Association Scholarship was established in 2016 by the Nursing Student Association at Patrick and Henry Community College. An award is made to a registered nursing student who is a current NSA member, participates in fundraisers and community projects for the NSA, has a cumulative GPA of 3.0 or higher, and a letter of recommendation from a teacher, community leader, or employer. This year's winner of the scholarship is Allison Boaz.
An important part of the nursing pinning ceremony is the lighting of the nursing lamp. This was due to Florence Nightingale. Florence Nightingale was a British nurse who is considered the founder of modern nursing. She is credited with creating the foundation of nursing, which is still followed today, and her name has become synonymous with the profession. This icon is also known across the world as the Lady with the Lamp. It was Nightingale's work for wounded soldiers during the Crimean War that gained her this title. Amidst the war, which was fought between 1853 to 1856, Florence Nightingale led a group of 38 nurses she had trained to the barrack hospital located in Scutari to treat the sick and wounded British troops. Once there, her and her team realized that the nurses were overworked, there was not enough medicine, and the hospitals were in such terrible condition that many injured soldiers were dying not of their battle wounds, but of other contracted infections. In addition to procuring the required medicines and equipment, Florence Nightingale also ensured that the wards were tidied up and cleaned regularly. She also set and ensured compliance with basic healthcare standards, nutrition, and personal hygiene by making sure everyone washed their hands to prevent the spread of germs, a gold standard that is still practiced today by healthcare workers. The nickname the Lady with the Lamp was given as Nightingale would tend to soldiers around the clock, often wandering the wards at night, carrying out duties with a small lamp in her hands.
It is our tradition here at Patrick and Henry Community College to invite all nurses in the audience to stand and join us in the Nursing Pledge. It is located at the back of your program. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. Please join me in congratulating the Fall 2022 RN graduates of Patrick and Henry Community College.